Folks, thanks for joining us today. My name is John Dubas with Premier Marketing, and we'll be spending the next hour or so discussing a couple of programs that can have a great influence not only on your insurance practice, but on the folks that you serve in the Medicare community. And these are the assistance programs, referred to as Low Income Subsidy, LIS, Extra Help, and the Medicare Savings Programs, the MSP programs. We're going to go through a great deal of detail, some of it very quickly, much of it for your reference for the future. And we wanted to make certain that you had that detail as you work with folks in this space. Today's presentation is being recorded, and once that recording uploads, it will be available on our website at premiersmi.com and on our YouTube channel as well. For folks who have raised their hands in interest in today's presentation, you will also be receiving an email from us, including the link to the presentation and additional information that we reference throughout the course of the presentation itself. There is a section in the software package for you to use for questions. Keep in mind we answer many of the questions through the course of the presentation, but we will make certain that we address your request for additional information and make certain that you get full value out of your time. One of the things we'll start with, for those of you who aren't as familiar with Premier Marketing as others, is a bit of a level set. And that is the fact that Premier Marketing is a national marketing organization founded in 1968 that's part of the Integrity Marketing Platform, with offices across the country, contracted in all 50 states. We act as an insurance wholesaler working with independent insurance agents and agencies such as yourself, and we do so through contracts at the highest possible commission levels, including recruiting contracts for those who qualify. That offering comes in as a part of a full portfolio of products, including the base Medicare programs that are influenced much by what we discussed today. Those are the Medicare Advantage and Medicare Supplement programs and a standalone Part D drug plans. But we also have a full portfolio of life insurance and annuity products, final expense life insurance, pre-need plans, long and short-term care programs, disability income plans, and those ancillary benefits, dental, vision, hearing, critical illness, cancer, hospital indemnity, accident, and telehealth programs that help with folks that don't have that sort of coverage in their base medical coverages for multitude of purposes. The Medicare Advantage programs include the national carriers that make a difference across the country and the regional carriers that are strong in many areas that can make a difference for you in your market. And that same philosophy carries over into the standalone Part D prescription drug programs, or in most cases, these programs are available as part of your Medicare Advantage contract, or that same contract that you have for that. One exception, Mutual of Omaha. This is a separate contract from any of their other offerings. It's only a PDP contract. And the Clever RX program is actually a discount program, not a prescription drug plan sanctioned by the government. Medicare Supplements, big portfolio of products. Some of these aren't influenced as much by today's topic as some of the others, since many folks who take out a Medicare supplement will go with that because they have more disposable income, or for other reasons, of course. But the PDP component that is necessary to get the drug coverage is crucial for these programs as well. And we want to make certain that we help people across the entire spectrum of the Medicare beneficiary income levels. And this helps us do that, not only in this instance, but across the board when we look at other topics as well. Ancillary products in each of those categories, you got the national leaders there for you for your needs for your prospects and your clients. And this takes care of those additional set areas where financial protection is necessary in each of these areas because of the needs that are generated by some of the base coverages, what they have and what they don't. And that's important because it's a huge opportunity in Medicare. You look at the aging of the baby boomers, the silver tsunami, 1 every 10 seconds, 10,000 plus a day, based just on age. Huge market. Some of them are continuing to work past the age of 65 for one reason or another. Pandemic has had a bearing. The time period for the trailing end of the baby boomers to get full Social Security benefits, well, it goes up to age 65. So some folks are working past that age, not accessing all the Medicare benefits when they're first eligible for one reason or another. But we do have a segment of the Medicare population under the age of 65, 15 to 17% is some of the numbers that I read, that access Medicare benefits because of disability, and these folks are often folks that really need the assistance of the programs that we discussed today. And that's part of an overall scenario where the population that has access to Medicare, well, 2/3 of them have 3+ chronic conditions. More than half of them have some challenges with their income and assets. And so are being able to not only offer the programs that help people across the board, but also improve those circumstances by the different assistance programs can make a huge difference and can differentiate you from your peers in the field and make certain that we're addressing the needs of the folks that we are visiting with. We do so because, hey, they've got choices. Folks don't have to do anything in a manner of speaking. They can decline Part B should they choose to do so. Thankfully, not many do. Some do with good reason. But regardless of that choice, if they self-insure with just original Medicare, many of them will pick up that Part D program that helps with the prescription drug costs. So our topics today are germane for these folks. And then there are people that will cover the shortfall in the medical expenses by taking out a standardized, modernized Medicare Supplement program. And in doing so, they still need a Part D program to cover medications. And today's topic will help address that. And then, of course, there are the folks that will bundle all of their benefits into a singular package under the Medicare Advantage programs, the Part C programs. And we find that these people can be influenced greatly by the Medicare Savings programs, but also the low income subsidy component, because in most instances, the Medicare Advantage programs have the medication benefit integrated into their base coverage. So in each of these choices, having the detail that we need to help them with certain expenses through these assistance programs can make a great difference, not only as to how their choice performs, but also our opportunity to work with folks throughout the year through the use of these programs and each of the choices that are available to the Medicare population. It's been a pretty even split in the past between Medicare Advantage and Med Sup programs. You see Medicare, original Medicare only. That includes folks that are dual beneficiaries, Medicare and Medicaid, a topic for today's presentation. There's also folks in this category that are accessing benefits through the VA, through retirement programs, or self-insuring. So we've got a number of folks that are affected by assistance programs or could be affected by assistance programs. And we're seeing that over the last couple of years, in light of some of the circumstances brought about by COVID-19 and its effect upon society, where we're seeing many more people go into Medicare Advantage plans on a percentage basis. And these are folks that are really subject to additional help in each of the programs that we'll discuss today. In order to do some of the things we need to do, however, we need to properly communicate. So one of the things that you'll see as part of the follow-up that you'll receive is a link to this guide, speaking the language that helps us explain in clear terms what's going on with what we're doing. So if we just talk LIS, there's another acronym, low income subsidy. If folks don't know what that means, well, gee, we need to make certain that in our discussions with them, we're limiting the use of some of the acronyms that we commonly may use in discussions with ourselves and our marketing partners. But this gives you the ability to make certain that, hey, I did properly define what IEP, OEP, MOUSC means in this circumstance. So we want to make certain that it not only gives us the information we need to translate the language, but also remind us to limit some of the use of acronyms in our discussions to make certain that we're properly communicating with folks that, hey, they may not know what exactly we're talking about if we use just letters. One big piece of why the assistance programs can generate additional interest in the agent community when it comes to marketing is the fact that the standard election periods can be influenced by the use of these programs, but it does create one of the special election periods that allows us to change coverages throughout the year. And we see as we scroll through this, there's a ton of SEPs, but when you look at some of the standardized SEPs, a lot of it deals with income and assets. So knowing some of the differences about these programs, how you can make use of them, and we see them labeled out here, it can affect the choices of their base medical, but also improve their circumstances And as I mentioned, and hence the reason for the SEP chart, is it gives us the opportunity to change coverages to something that may be more in their best interest than what they have done in the past, because hey, there's a good probability they didn't look at their coverages last fall. They didn't do anything with a comparison piece on it, no matter what their base coverages are. And because we're talking about folks that maybe, well, they are of lower income, these are folks that are particularly susceptible to price increases and some of the things that come into play. And there are pieces out there, studies out there that show that if someone does nothing with their coverages, particularly when you're looking at some of the medication coverages, it's costing them money, and in certain circumstances, big money. And we'll discuss why in just a second. They're not using the government sites. They're not actually reading the Medicare and You handbook that's sent to them either physically or electronically, not utilizing some of the electronic pieces that are out there or the information on the internet. So we want to make certain that we help them understand what their coverages are, bring to light some of the options that they have available that they may not even be aware of, and make certain that we influence their financial wherewithal in a positive factor, because it's getting to be a really big part of the people that we serve, the numbers that we serve. So it's a large audience that can be very much in the bullseye, so to speak, in the eligibility with this. And we then need to make certain that the programs that we use, the carriers with whom we associate, the marketing organizations with whom we contract, give us the capability of presenting information in the fashion that can be received by the public that we're working with. So we may have something that starts with a in-person presentation and do some follow-up virtually. The entire circumstance may be virtually, or it might be a pivot back and forth. Having those details available and the capability of delivering that information in either fashion is very important, particularly when we deal with some of the numbers. We're in a very number heavy presentation today. So having that detail together can make a big difference for you and for the people you visit with. And the population is increasingly digitally savvy through the training that they've gone through. We've all gone through in the last couple, 2-3 years, with information and services being delivered. Doctors' visits, primary care specialists, hospital stays, visits to the dentist, even faith-based services are being handled digitally, and the folks are becoming much more comfortable in delivering, or pardon me, in receiving that information in that fashion. So let's make certain that we have tools to deliver that information to them in the manner in which they prefer. So hence the topic. Finally, 10 minutes plus into today's presentation, let's look at some of these different programs and how that can make a difference for you in dealing with the population that you're visiting with. These are all, I want to remind you of this, part of the recording, and you will be receiving this as part of the follow-up, but there's a couple of extra guides and some of the different pieces that will come as part of that follow-up that we're looking to provide as a link. We're having some challenges when we put on different attachments going into people's spam filters, that sort of thing. We want to make certain that you have the reference material and that you can use it on an ongoing basis. So what's the value of these programs to your prospect, to the people you're visiting with? Keep in mind, prospect in this manner may be a current client as well, that you didn't perhaps ask about some of these additional programs that they may be eligible for. And so we're looking at anyone that we've dealt with or we hope to deal with in the Medicare community that may or may not be eligible for these programs. Visiting about people with these and mentioning some of the detail, well, even if the individual you're talking with doesn't qualify, there may be other people that do, that they know, and it sets you up as a great source of additional people to speak with through the referral process. Keep in mind, either of these programs, while they help maximize the plan benefits that the person may already be on, it will help also change the financial responsibility they have by what these programs bring to the table. So you're maximizing plan benefits and you're minimizing the costs of the choice that are available to them. You will find that even doing so in that fashion gives you the opportunity to do that review. And keep in mind, that's heavily influenced by the fact that they probably haven't reviewed it in a year or two based on some of the information given to us by Kaiser Family Foundation, and going through and doing the analysis of their current medications and other needs can really help them understand that, hey, I need to do this annual review. Hey, I need to do it with this person because they're offering this information to me. And hey, this is going to make certain that I can minimize my cost, and I can do it throughout the year because these programs do create that special election period once per quarter through the first 3 quarters of the year, and it affects or can affect, depending upon the type of program that they qualify for, the cost of the plans, the applicable co-pays, co-insurance, coverage gap in the medication benefit, and possibly catastrophic coverage cost as well. It can also affect some bad or poor decisions they may have made in the past when it comes to enrolling in different programs on a timely basis, where if they have a penalty, these programs can help override that. But it is incredibly important to realize that both of these programs we'll discuss does not affect their current plan's formulary, step therapy, or quantity limits. And that gives us then the opportunity to do that review based on their medications to see what plans best drive down the cost and affect that plan choice based on, hey, what drugs are available. That plan formulary, well, if some of these folks didn't make a choice and were auto-enrolled in a program, which some of them may well be, that's an auto-enrollment program that doesn't take into account what medications they're taking. So that analysis can make a huge difference and make certain that you can drive down their cost. All of this, all in all, in each of these areas, it helps increase your prospect pool by looking at folks that you've already dealt with and perhaps didn't sell, enhance the benefits of the folks that you did enroll into a program by maximizing their benefits. It gives you that special election period, but also creates that great source for referrals as well. It does do a number of things for your book of business too, and it helps you by laying out the information on these programs, making the folks aware of the fact that, hey, these are available. My agent is delivering this information for me, and so we're looking to make certain that we're maintaining the most cost-effective programs that is possible. So we're doing what is best for our prospects and our clients, and we're making it harder for anyone else to replace you as their agent. Because if you're maximizing the benefits, you're doing the annual reviews to make certain that they're on the program that can best suit their financial wherewithal, who's going to take that person from you? It gives you the opportunity as well to cross-sell, and studies have shown the more programs you have in the place, even if they're with different companies, well, it drives up your persistency, your retention is better, and it makes certain that you're doing so with your current client base, since they're already on a program that you offered them, enrolled them in, and are being paid a commission upon. It helps enhance that program, makes it harder for anyone to pull. And as I mentioned, if there is an opportunity to enroll them into a program that better suits their needs, it creates that special election period in that first 3 quarters. Fourth quarter is handled by the annual election period, for you to make certain that you can do it. So it enables you then to manage your time much more effectively, drawing new blood into your agency, but also timing out those reviews of the folks that are already part of your book of business, so you can make certain you have a mix of prospects as well. People who haven't done business with you, people that have, where you're cementing that relationship and creating the likelihood of a referral and making certain that they stay with you as their agent. It's also a category here that if many folks, if they've worked the dual special needs programs in the past, you'll find that sometimes the folks will have a different mindset when it comes to what you can do for them and what you can offer. When you look at the folks that are qualified or sometimes referred to as the near poor, got a different mindset. You're dealing with people that haven't had everything paid for. They don't have an entitlement mentality as some of the folks that have full coverage across the board without any out-of-pocket stuff. So you've got an opportunity there to work with a population that needs your help, looks forward to these assistance programs, but then looks at you in the eyes of someone who says, hey, that's my agent. I'm going to talk to other people about them. I'm going to look at some of these other programs that they're offering. I'm going to make certain that I stay with this person who has my best interest at heart. When we look at the Medicare savings programs, particularly, this is a little bit different because these folks are at 100 to 135% of federal poverty level, and it creates a bit of a different opportunity. And in order for someone to benefit from these programs to a great deal that can help us is, of course, anyone with Part A and Part B can switch to these C plans, the Medicare Advantage programs that we hear so much about on television. Any old celebrity or ex-professional football player can come on and espouse the joys of what they're doing there. And if nothing else, we can box our way into it, George. But if someone qualifies for these MSPs, it can affect any penalties they may have by enrolling late into the programs that are part of their offering, the Medicare Advantage plans, Part B benefits, Part D benefits. It can make a big difference there. But for some of these folks, if they qualify for the QMB program, we'll discuss that in detail in just a second, it helps them maximize the value they can get out of a dual special needs plan, and in many circumstances is the minimum requirement for enrollment for full benefits based on these programs based by or offered by different carriers. It then affects the copays that they have on the program that they're in. Even if it's a Medicare Advantage program, a standard Medicare Advantage program, these out-of-pocket exposure, well, it's limited by these programs and can affect their plan exposure simply by the fact that they're getting help with a Medicare savings program. It, once again, however, does not affect some of the base requirements in their current prescription drug program. So if someone enrolls in a Medicare savings program, the LIS benefit comes with it naturally, and we'll discuss that in a second, but it doesn't affect the drugs that are on the list. So if someone gets into this and they say, well, I'm looking for this medication, it's not on my current plan, enrolling them in an MSP doesn't affect that. We have to look for other alternatives. We have the SEP that allows us to do that. If the medications are set up in a step therapy where a person has to try one medication before they go to another in order to get the drugs covered, that's not affected by these programs either. Neither are quantity limits. There are medications on different formularies that say, hey, you only get so many of these pills per this time period. Like the low income subsidy, enrollment in a Medicare savings program does not affect that base requirement or the base information that comes with their current program. Hence, the need for the SEP if there are other programs that can help address that in a different fashion. Low income subsidy, well, in addition to providing the access to the prescription drug benefit, it helps people protect them from the coverage gap, the donut hole. Everyone says it's gone. Well, it's still additional financial exposure there. These programs can help there. If someone enrolled late to a Part D, enrolled after the time period in which they're first eligible and they have that penalty, enrollment in a low income subsidy takes care of that penalty. It does, once again, create that special election period. And by going through this process and getting the additional help for their medications, it can trigger the application, or does trigger the application for Medicare savings programs to give them even additional help behind the scenes. If you know someone that would qualify for a Medicare savings program, you don't necessarily want to wait for that to happen as part of the natural life cycle of an enrollment into a low income subsidy program, because it can take a while, and they can create a application and submit it for the Medicare savings programs ahead of time, and they can get that additional assistance much more quickly if they qualify for it. To be eligible for low income subsidy, well, they got to have Medicare Part A and or Part B. They got to live in the United States, the 50 states or the District of Columbia. and they must meet certain financial criteria, both an income and an assets test. Some folks are deemed eligible where they automatically get this assistance because they are receiving a different needs-based benefit like full Medicaid or SSI or one of the Medicare savings programs that we'll discuss today, the QMBs, the SlimBs, and the QIs. These three groups don't have to apply for LIS because it comes as part of that program. And once a person is found eligible, generally that person has the benefit for the remainder of the year. What do you mean by generally, John? Well, if there's a big change in their economic status, hey, I actually won the lottery, well, they're going to lose LIS, but gee, take that lottery money. What we have as well is a difference year over year on the base benefits available through the Part D programs. These are the standard benefits that are influenced as a baseline for some of the drug plans. Most of the medication coverage that we see in the Part D programs, well, they don't necessarily have this as the base. They enhance the benefits, and we see that these change year over year. Let's flip by a slide in just a second that'll show you a part of the presentation we did last year on this topic, and we see how these numbers changed from year over year to year because it gives us a 3-year parameter. But the base Part D benefits, the programs that we see for, oh gee, you can get a Part D plan for $8. Well, I'll guarantee you that that $8 PDP program has a deductible in it, probably the full deductible that's allowed by law of $480. It has those standard limits like all PDP programs do, or in certain circumstances, depending upon how it's set up in an MA PD program, a Medicare Advantage prescription drug plan, it may have these same coverages they have to roll through as well with that initial coverage benefit of $4,430 where you got to come out of pocket. You got a threshold as to how that can happen before you reach the catastrophic care and how you enter into that time period in the middle where you have greater out-of-pocket exposure. What we see with these programs, however, based on where they qualify, are some standardized or some standard, I should say, co-payments within their medication coverages. And as we visit with folks, these are a pretty good clue for us to find out, well, gee, do they already have this in place? And if so, is that SEP already used? Can I change based on that special election period their coverages? Well, that's where some of the association with different carriers can be really helpful because they can verify, one, what level of coverage they have, and two, have they used that special election period for that quarter? So it will help you in planning and serving the needs of your prospects and clients. But generally $395 for generic or multi-level drugs in that area, and then $985 for other medications, which is up a bit from last year, which, as I mentioned before, is up a bit from the year before as well. So what we've got then is a circumstance where we can identify these individuals simply by what they're paying for their medications. Sometimes they don't always remember. That's why having that back office support with a carrier that can offer that service or through other organizations that identify how we can help these individuals. For people that are on a Part D program that is above a benchmark, what do they pay? Well, gee, let's start with first, what is a benchmark? And that's basically the maximum monthly Medicare Part D premium that'll be paid for CMS for people that qualify for these programs. Because you have variance in the premiums of the plans that are available, you will see that some plans, if they're above a certain premium level, may still require the individual to pay something for their drug plans above the premium that's set by the government as a benchmark. And some of the folks, if they're qualifying for only partial help, the premium may only be reduced based on their circumstances. There's a ton of programs out there that can help identify what these plans are and what the availability of benchmark programs are, because they'll vary from state to state, from area to area. And we want to make certain that we take care of them because these programs, the benchmark does change over time as well, year over year, and so does the number of plans that are available that are fully subsidized. And what we saw this year versus last year is a pretty substantial drop in the number of programs that are fully subsidized by low income subsidy. We went from 269 plans to 198. So if you have about 70% of the population not looking at their coverages year over year, not just for what the plan covers, but what it costs as a premium, you're going to find quite a number of folks that really need to review these coverages and consider other options in order to fully maximize the value of this assistance program. What we have also is for folks that don't do a review is some things that just change because there are medications that are part of a program that remain on formulary that might change tiers, or they might change how that plan covers it, that medication. You will see sometimes on your own coverage notifications from your insurance carrier saying, hey, this drug has gone off formulary, here's some options. Does everyone speak to that with their doctor that's prescribed that medication? Or if they haven't been into the doctor yet, even though we're just touching the beginning of March for this year of the physician that's prescribed that medication, are they just renewing it and then dealing with the financial consequences thereafter? Well, that's a possibility. We want to make certain that we not only address what medications are on the list, but where they're on the list as well, in order to make certain that we can minimize that financial exposure. Programs that we offer through our organization, through Medicare Center, can help you do that. The plan finder on Medicare.gov can do it as well. Keep in mind that's not meant as a marketing tool, much as some of the other software programs that are out there do. But even if the medications stay on the list, doesn't mean they're still priced the same year over year. And that can make a difference then as to what comes out of their pocket and how that can influence the use of these programs in both cementing business to you that you already have on your books and increasing your business by working with people that aren't with you. And then, of course, the factor of them talking to other people about you to drive business to you through referrals. I'm going to lay this out there one more time. We've already talked about it a few times in the presentation, but these programs do create that special election period. Go back to those numbers that we talked about, 7 and 10, not reviewing their coverage year over year. Well, some of those 7 might be some of the folks that we visited with that we weren't able to speak with during AEP to create that annual review. Some of you are better than others at making certain that that happens. But if you miss someone on your book, it enables you to do that and go in and take care of these people and utilize that SEP if a change is necessary. It's also, of course, a great prospecting and referral tool. We also have to come in and keep in mind that if someone has medication coverage and they haven't done a review and they don't have low income subsidy, Kaiser Family Foundation tells us in this piece that nearly 3/4 of those folks will pay higher premiums in 22 than they did in 21. And so that's another factor as to what we need to do to create a sense of urgency for people to speak with us about their coverages and consider what needs to be done. Now, we're looking at a monthly increase. That's not a huge number for us. But if people may be in that category that qualifies for low income subsidy and Medicare Savings Plans, keep that definition in the back of your mind, where a smaller amount on a smaller budget, smaller amount to us on a smaller budget, can make a big difference as to their monthly budgeting for other expenses moving forward. Low income subsidy has a couple of different levels. You got the full subsidy, the full help program, which is for people that are of lower income and fewer resources, and partial help. A big difference between low income subsidy and Medicare Savings Plans is the assistance on the Medicare Savings Plans go to 135% of federal poverty level, where a low income subsidy goes up to 150% of federal poverty level. So you got a larger number then that can be positively affected by these assistance programs. And keep in mind, both levels of assistance, full and partial subsidies, do help eliminate that Part D coverage gap, the dollars that come out of their pocket once they exhaust that initial level of assistance. It also gives us the opportunity to do away with, as long as they qualify for this assistance program, that premium penalty. If they didn't enroll in a Part D program when they were first eligible and they're getting that 10% whack, well, this will help take care of that too. And it's important to know too that people who qualify for full subsidy of these programs, well, as long as they're in that benchmark or below type of category, it'll eliminate the deductible, it'll drive down their co-payments even on their current plans. So if they've got a medication that on their current low or on their current PDP program that might have, let's say, a $4 generic copayment and a $15 name brand tier 2 copayment, well, they can stay on that same plan and it's going to drive down their co-payments on that, even if, you know, through the course of our presentation with these folks and see if they qualify, well, that's still the best plan for them for what we're looking to do and for their circumstances, but it'll save them some dollars there and still create that opportunity for us to generate additional business by cementing that person to us, so our renewals continue, but also create the likelihood of referrals as well. It does some really cool things is when it helps drive down the cost across the spectrum of financial contributions throughout the year, dependent upon the stage of help that they get. And partial help, well, they can have up to a $99 deductible under these programs, but keep in mind that may be for someone who is currently paying a $450 deductible. You can really drive down that out-of-pocket exposure at the beginning of the year, drive down the co-payments and co-insurance that they have for the rest of the year as well. And we see on the partial scale how that happens, what portion of their costs are subsidized by being eligible for these programs. And you might look at some of this and go, well, gee, at 146 to 150% of federal poverty level, well, they're still paying 75% of their premium. Well, that's just talking about premium dollars. It still drives down cost of medications through the co-payments. It creates that opportunity for us then to look at and say, hey, you might have some better options out there when it comes to your prescription drug plans. And because you can do so electronically and get the scope and do everything else you need in order to set up that appointment, it creates that opportunity for us to use that special election period and move them to a different program that may better suit their needs. Keep in mind, 3/4 of them didn't do a review year over year, and they've got costs that are kind of built into the system. And at this point in time of the year, they may now just be realizing that, hey, that cost went up. So they may well be a more receptive individual to your outreach as well. These are different pieces that are available to you and are part of information that's brought to us by the National Council on Aging. And these are guides that tell us in each of these categories, in each of the assistance program levels based on their income and assets, how these programs are going to influence their choices moving forward and their current choice should they choose not to do anything at all. These are guides that will come to you as part of the follow-up with these links. Obviously, you'll see this link and you can type it out when you receive the presentation as well. But we want to make certain that you have these programs as reference. So, hey, I can't memorize all these numbers. You don't have to. It's all here for you. And keep in mind, it's going to look a little bit, well, it's going to look exactly like this. So you have these for low income subsidy, and they'll come to you as part of the follow-up. And you'll have these for the Medicare savings programs as well. So you have that detail. So you can converse with people in these, well, if they're qualifying for these or not, helping determine whether they qualify for them and how that can come about. And you'll see, of course, differences on the continental United States and the District of Columbia. The numbers are different for both Alaska and Hawaii. They're higher there which I don't know how many of you do a lot of business in Alaska. Not a lot of people do. Same thing with Hawaii. You got to mainlanders, they just don't deal with us as well as some of the folks that are living on Hawaii. So we want to make certain then that once we determine that folks may benefit from these assistance programs, or benefit, yeah, they're going to if they qualify for them. Do they qualify? Well, once they do, or we have the idea that they may, we can, as an advocate on their part, compliantly help them with the application process. It's a area where you want to be really careful about becoming a social worker entirely, but an application through the Social Security website for the extra help programs, or through the benefits checkup organization, or through other programs that are offered by different carriers, doing it online is really simple, pretty quick. They don't have to supply documentation for it, and the determination of whether or not yay or nay comes their way, well, that's handled in a pretty timely fashion. And many of these folks may not have online access to do this by themselves. So they have opportunities to submit on a paper basis, or go to the Social Security office and apply through caseworkers there. But you know what happens then? Well, you got to get that round to it. Don't have the transportation, whatever other reason there may be. And if you're pushing them outside your system of influence, with outside of your realm of influence, you may well lose control of that individual moving forward too. So we want to make certain that, one, we recognize that special marriage between Medicare and Social Security, much like a webinar we did last week, but also how to help people get this coverage. It's of great help to us as well to realize that some of the benefits checkup programs may be subsidized by one of the carriers that we work with. Many of them will use this as their system to do verifications or to help people qualify for this. There's a couple carriers that have their own way of doing it. But in either way, you have a better chance here, if you're not helping them in the enrollment process themselves, controlling what happens to that individual once the application goes in and they qualify. You do have the option of having them work with SHIP to help with some of this, but I will look you square into the computer monitor and say, hey, many times when you use SHIP, you lose control of your prospect and your client. So we want to make certain that we not only handle the application process in a manner that can get them qualified as quickly as possible, which is a good shot here, making certain that, or helping to guarantee that they actually go through the process because we're helping them with it, and making certain we can control that individual once that goes into play, once they qualify for this, because that's when that SEP, that special election period, is generated, once this is in play, and then you can help do that review for other coverages and enroll them in other programs. Online, of course, is the simplest way to do it. We want to make certain that we do things in a timely fashion. We can make certain that we can get people involved as quickly as possible, and make certain that we control the outcome as well. Paper apps, I used to keep them in my binder all the time because it helped me collect the material or the information I knew that I needed to help in this process, because technically you can do it online without the presence. And collecting this information, then you can do it then and control your time, manage your time, and do it after business hours on their behalf, either electronically or utilizing the paper application, so you can do it electronically on that platform, using the numbers off that to go back to electronic applications. Great way to manage your time, great way to also stay in touch with the individuals that you visit with, and mine for additional referrals. That letter, they get it pretty quickly. It's going to tell them whether or not they have been approved for that. You can then, of course, verify it with one of the carriers services that say, gee, they got LIS in place, and then create that additional appointment, live or virtually, to do the review and change coverages should they need to do so. You got a ton of reference material for this. If you want to deep dive even further in this, since I've already gone really long on it, well, you've got different pieces here that can help you, guide you through different organizations that give you additional information, but also help in this effort as well. This is a great topic for folks that are doing seminars and webinars. The National Council on Aging has a presentation that they make available that you can go through and use this as a presentation for the public. This is the version I'm showing you really quickly now, needs to be updated for 2022, those numbers, but you have one for both MSPs and LISs, Medicare Savings Plans, low income subsidy programs. So this gives us then the opportunity to use this in our community outreach and address groups with this as a topic. I gotta tell you, right now, particularly in the end of the first quarter of the year, you got people that have gone to the pharmacy. They may find out that, gee, I'm a heavy utilizer of medications. I've already gone through a bunch of my drug benefit. I need help. Hot topic, low income subsidy and Medicare savings plans. Perfect segue into this because it's important for us to realize that in the past, folks that are on an MAPD plan, a Medicare Advantage prescription drug program, in which they're accessing their Medicare benefits fully through the bundled programs, the all-in-one programs, however the commercials want to lay out there. Well, a good portion of the people that have their drug coverage through a Medicare Advantage plan may also well qualify for low-income subsidy, and you can drive down the cost of their medication cost right here through this system. And once again, positively influence what they have to pay, but also give you the opportunity to go into a review of their Medicare Advantage programs, which they probably didn't do in the fall. And through the creation of that SEP, that special election period, you can help them change coverages now as well. And what you have is in a huge market within the Medicare community where of those 62, 63 million people on Medicare, you got, gee, a big chunk of them that are qualifying for MSPs or could already be enrolled in one or qualify for them. And it's not full immersion in these programs either. People are eligible for them. They don't have them in play for one reason or another. You're going through and doing a review. Boy, talk about setting yourself up as a hero. Not that you're in this for an attaboy necessarily, but it gives you the ability to positively influence these individuals' day-to-day standard of living and also create more business a couple different ways with the people you address and through referrals as well. So these Medicare savings programs are administered by Medicaid in conjunction with the different states in which the person resides, drive down out-of-pocket cost. They may be called something different in your state from someone else's state, but it's all lipstick on the pig. They're the same type of benefits that are available to you. So keep in mind, as I showed you just a bit ago, these presentations about these programs, the National Council on Aging programs, those presentations, that's going to come to you as part of the follow-up. Obviously, you'll want to replace my ugly mug with your picture and your contact information. I'll make certain that they're updated for 2022, but you'll get those and then they're available for you to use. Webinars, seminars, whatever is appropriate. These different categories, you get different levels of assistance. We've gone through these in different recordings in the past, but keep in mind the QMBs, the qualified Medicare beneficiaries, the QMB people. These are folks that are accessing assistance in a program that was created clear back in 1988. Boy, I'm getting old. I never would have used to thought I'd refer to clear back in 1988. Well, the majority of people who qualify for these, they don't have them in play across the country. The SlimBs, legislation a couple years later, a bigger percentage of the folks that are eligible for these are not enrolled in them. And the qualified one individuals, well, bigger portion of that too. It is a sliding scale in a manner of speaking as to what benefits they get by one of these programs. But in each of the circumstances, in any of these levels of assistance, the minimum you're going to be able to do for them that positively affects their budget is the subsidy of their Part B premium. And we saw what happened to that based on, gee, we got one of the largest increases in our Social Security benefit in years. Yeah, you sure did. And a bunch of it went to pay for an increase, a massive increase, a historic increase in your Part B premium, where the majority of people are paying $170.10 for their Part B premium. We can help them with one of these programs. It'll absorb that cost. We need to make certain that we can help them do that. In order to be eligible, they got to have Medicare Part A. They got to satisfy the income and assets test, and that varies from state to state, the assets test at least. And the application process for this is a bit more complicated, a little longer than LIS is. But we can help them through it, and we can help use some of the resources we have available in order to do so. So we can utilize the programs. We can help them apply ourselves, but we can also utilize the programs that are assistance programs aimed at this population through the carriers with whom we contract. And it's a situation much like low income subsidy. They're going to have to do it year over year. So what's that do for you? Yeah, it's a little more work, but it also creates that urgency within your book of business and the people you may have talked to in the past that you didn't do business with to do that annual review, because this is part of that process that they have to qualify overall. Now, keep in mind, helping people with these programs themselves, it's not a commissionable event. It doesn't give you or earn any dollars for you per se for helping them through this process. What it does is, by putting these programs in play, create the opportunity for you to sell more frequently. And what do you mean by sell more? Well, you're not selling them these programs. You're just helping them enroll in them. You're not the person that is saying yay or nay they're going to get the coverages, and don't ever set yourself up as that individual. That'll put you in hot water really quickly. But it creates that opening for that review that then can bring about a change in their coverages, and that's the commissionable amount. These Medicare savings programs do eliminate the Part B late enrollment penalty. So you'll see in circumstances, well, many folks are very interested in working the market that deals with veterans. Many veterans deferred their Part B or declined their Part B because, oh, I'm going to get all my help through the VA. And then they discover later on that, hey, that may not be the circumstance, but they may well be individuals that qualify for these assistance programs, and it can address that late enrollment penalty then. So you have another avenue in which you can help that subset, that niche market, in dealing with veterans. I'm not talking about TRICARE for Life. I'm dealing with the people, the veterans that weren't career or don't qualify for TRICARE for Life. So it'll help with that circumstances. And unlike qualifying for Medicaid in order to go into a long-term care facility, there's no estate recovery that's involved with these programs. And folks that do qualify for a Medicare Savings Plan, once again, as we talked about earlier, they automatically get that Part D extra help, the subsidy that comes as part of the application process there for their medication cost. You've got a whole bunch of governmental agencies that are involved in this situation. CMS and the states working together, CMS doing oversight, helping pay for part of it. The state Medicaid agencies in your state administer these programs themselves, where they help determine the eligibility, and they're the ones that come up with some of the dollars for the limitations on the financial exposure for the folks that qualify. But we want to make certain that we put this in play and we help ease the process, make it as simple as possible for the folks, because a lot of them, they'll go, man, I don't know if this is worth it, and then they don't do it. Our helping them complete the process not only enhances their current situation, but once again, man, we're not being totally altruistic in this regard. That's what gives us the opportunity to help them change their coverages. What's that do? Well, that's the commissionable event, because we're enrolling them in something different than what they have. Or if they're in a program we put them in, help cement them in that program, and we continue to receive the renewals on both a PDP or an MA plan that has lifetime renewals. I mentioned, and I showed this to you before when we flipped through the LIS piece, these charts are available from the National Council on Aging. Some of you might Google and get them a little more quickly than what I can deliver them to you, but they're going to come to you. And we're going to try this a couple of different ways, both as a link and as an attachment, because these are only a couple, 3 pages, and they're not huge. I'm going to try something different with the presentation itself and create a link for it, because some of these I'm becoming much too verbose. Yeah, we're nearly at the end of our time here, and I'm going to run through some things really quickly. But the presentations are large, and we're getting them kicked out of the well, servers are catching them, or it won't go through servers, or the spam filters will catch them. So you've got a ton of info in here that can be greatly helpful for you. And this piece, that's part of the second guide. If you're contracted in multiple states, well, how does this affect us, our marketing efforts across state lines, in a manner of speaking? So you got that detail across the country. Keep in mind, all these programs, and I like to do this because this is a piece I created years and years ago, exclude one house and a car, no matter what the value of that house and car is. And this is an area where a lot of folks, where they'll say, well, they fit the income piece, but they don't fit the assets test. Well, they fit the asset. Well, you know what I mean. You can actually drive down the dollars they have, the liquid assets, by improving a house or improving a car, because they can't even give that money away. They can't give it to church. They can't give it to family. There's a recovery piece on that. A look back of 5 years. Investing it in a house and a car, though, that's a different animal. You also will encounter in certain states a subset of the population that is affected by dual demonstration plans, referred to as Medicare Medicaid plans. There were 11 of these at one point in time. And when I was updating the presentation, we see where it's dropped to these states that are currently listed. It gives you an idea of the companies that do these dual demonstration plans. Before you get too excited about the possibilities here where they're merging Medicare and Medicaid into a singular program, it's not available for broker distribution. Not a commissionable event. You can't really even tug and pull people out of a program where they have to do it themselves in order to drop out of a dual demonstration plan. But you'll see, particularly as a demonstration here in Texas, how that is only in certain counties, even though it says the state. It's not available everywhere in the state. And the number of folks that are influenced, as we can see here, well, it's not a huge number of the population. Sometimes you get that feeling, though, of, gee, with my luck, it's going to be my person that's in one of those programs. This gives you some additional information on that. If you are in one of those demonstration states, in order to keep this from going to 2 hours, just kidding, it's not going to last that long, we can get you specific information as it pertains to your state and your market. Why isn't everybody in these programs? Gee, John, you went through that slide and it said 67% that are eligible in QMB are not in the program. Well, sometimes people don't know about it. The government's done a pretty good job in the past about speaking about low income subsidy and the extra help programs. Not as much in the last few years as we've seen when the program first came available, but the MSP programs, Medicare Savings Plans, there's not a lot of advertisement about it. So sometimes folks just don't know. Or even if they got something, gee, do you read every piece of your mail? I'm staring at a pile here that I don't know why we have the mail sometimes anymore, because all it is junk mail. Gee, my junk mail is JUNQUE. When I send out stuff, it's different. But enrolling in these programs can be a bit difficult because some of the applications, as opposed to the LIS one where it's basically a 2-pager, well, at one point in time, the application for an MSP in the state of Texas was 17 pages long. You don't ask for your mother's maiden name, but they might as well, but for all the other information that's there. And where much of the information we use in our marketing or enrollment processes through the Medicare market has to be a certain font size, they don't always, the applications for these don't always agree with that. And even if the folks do realize they may qualify for it, but they need help with the application process, well, there might be transportation problems to get them to someone that can help them. And we are dealing with a proud generation that will associate this with welfare, and they don't want that social stigma that comes with it. And they can say, hey, gee, don't want anything to do with that. We can help them overcome that by telling them of the benefits and at the fact that these are benefits that they are entitled to. You can do some things, as I mentioned, in helping them qualify for these programs through sending them to the Social Security office, working with a social worker, hoping they'll help, or use the My Advocate system with United Healthcare, or the benefit checkup systems with some of the other carriers, or through benefit checkups overall through a National Council on Aging, or do the application process with them. This is a big factor when it comes to folks that are active in the dual special needs space, because in order to qualify for a dual special needs plan, well, that individual's got to have A and B. They got to qualify for some level of assistance. Now, just because they qualify for some level of assistance doesn't mean that D-SNP may be the best choice for them. In most areas, the vast majority of areas, there are a couple of exceptions in different parts of the country. In order for them to get full benefit out of a dual SNP plan, they got to have QMB or better, QMB plus or better. They got to reside in that service area. And this is one area where end-stage renal exceptions may not qualify. Gee, John, let's take a step back in time. A couple years ago, I thought MA plans, they did away with that question. Regular MA plans, yeah, not all D-SNPs. So you need to make certain whatever program you're offering in that area for dual special needs plan, you know how they handle people with end-stage renal. Looking at this in all due candor, you're not going to run across a whole bunch of people that have ESRD in this space, but you need to be aware of it and how you deal with it. We also want to make certain for you folks that are working the spectrum of the Medicare population, including people that may prefer a Medigap or a Medicare Supplement policy. We got to see how these programs interact with Medigap policies. Is it the right choice for them? Well, that depends on the circumstances. For an individual that qualifies for QMB, you shouldn't be selling a Medigap policy to them. It's a good way to get spanked. You run across someone that qualifies for QMB and getting that active for them, helping them with that qualification process, well, it can suspend that Medigap policy for a couple of years. So if that circumstance changes and they want to go back to having the Medigap policy too, they can do so without underwriting. But when you run across the folks that have SLIMB or QI1 where they're not getting the medical expenses subsidized, only the Part B premium, that might be a valid way of helping them pay for their med sup. A lot of that depends upon what other programs are available in their area, but that is a valid area to look at. And we also want to make certain that for folks that are going into long-term care facilities and being paid, that care being paid by Medicaid, well, you'll find that most of the facilities, unless they have an ISNP, an institutional special needs plan, which is generally not available for distribution by a broker, you might see some disenrollments in that area. Resources, much like with LIS, are available to you through a number of different means. And I was reading a sponsored ad on Facebook last night, that talked about NCOA, National Council on Aging Assistance for Food Programs. And you read through the comments, and it was basically a big gripe section. Well, I didn't get this, I didn't get this, I didn't get this. And they miss some of the intent of what this is, but you got to be careful in many of these areas. If you go into other benefits that may be available to these individuals, what kind of pushback are you going to get? Once again, you got a program that's a presentation program that's available for both LIS and MSP that you can roll through. Why you're going to do that with us? Well, we're 5 minutes past the hour. I promise this will only be 4 or 5 minutes left. Well, you're going to do that for one, because, hey, I'm talking to you about it now. I want to make certain that you have the information you need to do so on a qualified basis. You got the detail. You got the resources to go back and address this population. And then you can take those numbers, create an agent profile, pick up some additional contracts for ancillary benefits or whatever other contract that you need electronically, and help people utilizing some dollars they may be saving. For some of these folks that qualify for these assistance programs, they're great candidates for final expense policies, a smaller premium program for burial expenses, or they may be that individual that is part of the low income subsidy community and they're on a program that doesn't give them enough dental benefits for what they need. Well, you can pick up a dental contract or two or whatever and make certain that you're addressing those needs. Hence the reason we went through the whole portfolio shtick at the beginning of the presentation. We want to make certain that we can utilize dollars to the best advantage to our prospects and clients. We do offer discounted E&O to our qualified agents as well. What's errors and admissions for a qualified agent? What makes me a qualified agent? You got a contract with us. But this is a program you own. It's not like being added to a blanket E&O for just one policy. You got to worry about whatever else comes into play. This will take care of you no matter whom you contract through. You can save a few bucks if you stick with just Premier, but this is a program that enables you to take care of that requirement for contracting in the insurance world with the different carriers that are out there, no matter who you're contracting through. We do also offer discounted continuing education bundles through our association with WebCE to keep your license in play. You can actually also add to your own benefit structure through a modified guarantee issue disability income plan for yourself in which you're paid a commission. So you can protect your ability to earn through this program. Much as where today's presentation is being recorded and is available on our website and on our YouTube channel. Well, if you're one of those individuals that goes and markets to the community for centers of influence, how do you do that? How do I work with churches? How do I work with providers? How do I work with and maximize a retail program? Details are available through past presentations as well. And of course, through your marketer, your agent success manager that you're working with Premier. These programs, if you got a contract with us, it gives you access to Medicare Center free. And this, if you haven't heard about it, a brief synopsis, available without cost to contracted agents for integrity platform partners like Premier, single login for 3 different quoting engines, powered by Connecture, Sunfire, and CSG. It gives you the opportunity and the wherewithal to collect that ever important scope of appointment by multiple means and store it for that 10-year period if you sell them or not, just like the government tells us we need to do. It puts the information in a CRM so you can work your book effectively and efficiently and do that year-over-year comparison, because these tools, you talk about those first 2 quoting engines, a lot of it deals with the price of drugs. So you can go back year over year. It also has a resource tab in there that gives you sales scripts and other tools that can make you more effective as well, including a piece. Well, CSG has a lot of really cool tools in there, but they got a great cross-selling tool in there too that, hey, get a link to a demonstration of that as well. Different carriers will offer different incentives periodically, not in the MA or PDP world because max comp is set by the government and we can't go beyond that, but the carriers do offer other incentives for med subs, ancillary products, final expense, life insurance, different programs that are out there on the short-term care programs. This may help you qualify for carrier trips and for incentive programs we have at Premier as well. We want to support you in getting you in front of people too. So different means of prospecting into the community, including helping subsidize the cost of mailers, driving down that cost based on production through vetted lead vendors, so we can get that detail out to you as inexpensively and as effectively as possible. And for folks that don't want to do a full campaign that where they direct the mail, you can actually purchase direct mail responses through an organization we work with that, well, these prices can and do vary from area to area and from parts of time in the year. It's supply and demand here. Great way to fill in your schedule. The internet leads are Facebook based. Gee, easy for me to say. And there's a program for final expense and Medicare as well. Talk about a microwave lead here. You get it quickly, you got to respond quickly as well. And we have that T65 locator that's available without cost to our contracted agents, where you download a program on your smartphone, register through your smartphone, they'll verify you have a contract with us, and it'll physically locate people in different age brackets in a different area to help you if you want to do door knocking for campaigns that allow that. Can't do that for MA and PDP. Please don't do that. But you can for dental, final expense, a whole bunch of other programs, and that can help you in your marketing efforts too. We talk about the referral process and how being engaged in low income subsidy and Medicare savings program information dissemination can be so helpful in this area. This is a link to a program that helps you understand how you can maximize the value of your referrals, not only with the people that are involved in the sales process, but going back to your book of business and having those folks send people to you as well. We do all this because we want your business. I'm asking you for your business in this instance. We want to be referable for you too. Great people in the home office that are subject matter experts in different areas that can really help you across the board. And this is something you can put into play now. It's crucial that if you want to be involved in this, you don't wait around with this. You put it in play now. You know how to start up and make this work for you. Some simple things on what to ask and how to move. And as John Wayne said in the movie The Cowboys, slap a piece of bacon in that biscuit, saddle up, let's ride. We're burning daylight. Hey, we're going into the third month of the year already. It doesn't matter anytime throughout the year. This is something that can positively influence the pool of prospects you have day to day to visit with. So all that said and done, I'm going to check really quickly to see if I didn't address some of the questions as we go through here. And I tried to do it a little on the sly there and address them as they came up. And it appears I've taken care of that. But keep in mind, you can reach us through our toll-free number, 1-800-365-8208. You're working with a person within Premier, they're going to help you with these programs. If you're not, we're going to get you someone that does. And keep in mind, you can also access information on our website, contact us through the website. You can hit reply on the email you're going to get on follow-up, and we'll make certain that you get taken care of. I've already gone 12 minutes past the top of the hour, 10 minutes into the presentation, over the max presentation time I said I would, but I want to thank you for that investment of your time. We realize it's a precious resource. I thank you for that. For those of you that have done business with us in the past, I thank you for your business. For those of you that are considering doing even more business with us or business for the first time, I thank you for that. But until we're able to visit with you and help you with these programs and the portfolio of products, the back office support, the marketing programs that can come into play, I'm going to wish you good selling. Thanks so very much. We'll talk to you very, very soon.